If you suffer from hip impingement and you're also getting knee pain, this could be why. Dr. Nicholas Mercer with You Improve PT. So when you have hip impingement, a lot of times you will get pain and irritation and a restriction of range of motion in the hip with hip flexion and internal rotation, sometimes external rotation, right? So what can happen in the knee if we don't like to rotate those hips because we get that hip impingement pain is the knee can start to take over in more functional movements. For instance, if you're going down to pick up an object like so, grab and pick up, you can see what can happen at the knee if this hip doesn't like to flex, right? So instead of letting this hip flex, we're gonna push that knee forward in order to pick it up so we don't have to flex from the knee quite as much. That's one reason. It's going to put a lot of pressure on your knee. You're probably going to feel kind of overall knee pain through here after doing those activities, or if you need to do those activities lower to the ground. Now, some other issues that may come about during more athletic activities is those deficits in hip rotation, right? And the reason that we get knee pain during those activities is if the hips aren't rotating, if we can't control rotation at the hips, we are going to try to get that rotation at the knee. The problem is the knee has a very, very, very small amount of rotation that's normal, that's available to it. So once we reach that end range, we're starting to put these rotational stresses on the knee that it's not built for, it's not prepared for. So we're going to be stretching out ligaments, we're going to be putting a lot of pressure on the cartilage and tissues in the knee in ways that it's not prepared for or made for, and that's going to increase knee pain. So for instance, if I need to pivot and I can't pivot into my hip here, all of that is going to be torsional at my knee, and we're going to get a lot of different angles of stress and strain on that knee where we really aren't supposed to be loading the knee. We're supposed to be controlling that rotation at the hip. The hip has a lot of rotation and flexion and abduction and adduction available to it. The knee really only has flexion and extension as far as, as far as this is concerned, right? Again, it has a little bit of rotation, but the hip has a lot more. Speaking of adduction and abduction, if we can't stabilize abduction or adduction, those forces are going to go to the knee as well, right? We see this a lot even with people with ACL injuries and MCL injuries when they are doing athletic activities. They either get hit from the side and that knee buckles inward just like that in a rotation and adduction force that the knee is not built for. And then we get injuries and the ACL bust, the MCL bust, and you need surgery on that. That's probably not going to happen if you were just kind of experiencing some knee pain associated with your hip impingement. However, you can still put strain on those tissues. Those can get inflamed and cause a lot of pain. So what's the solution for this? Well, the solution is just to get your hips working like hips again, right? Get your hips working the way they need to. As far as things to manage the knee pain, we can use ice on the knee. Try not to use ice on muscular areas. Try to keep it to the joint. And we can incorporate some stretching of the quadriceps to kind of alleviate if there's any tension or restrictions in those quads. That can alleviate some of the pulling on the knee. But overall, if you really want that knee pain to go away and get that hip impingement kind of cleared up, we need to get the hip working like a hip should. The problem with that is there's a lot of things that can go wrong in the hip, right? There's a lot of causes for hip impingement. There's a lot of factors that go into developing, but also becoming pain-free with hip impingement. So there's a lot of different restrictions you may have. Who knows, is your restriction muscular? Is it more in the joint capsule? What movements are restricted? Is it more flexion, more internal rotation, more external rotation? And so that can get very, very complex. So managing that knee pain is going to be an important first step, and then getting the hip to move, rotate, abduct, adduct, flex, extend appropriately without hip impingement. Unfortunately, that's the key, isn't it? We have to fix that hip impingement, which is probably what you've been trying to do for a while. So to keep this video a little more brief, I will link a card up in the video here in order to show you a video that I already have uploaded on improving hip rotation. And also check out a lot of the other videos on the You Improve PT YouTube channel. We have a lot on hip impingement and getting the hips to work like hips should work. If you have any questions or you're interested in finding kind of a more complete solution for your hip impingement that is maybe associated with knee pain or some other hip pain, please check out our website, youimprovept.com. Send us an email. Send us a message to the website, call us. We are here to help you and help you get better and finally find relief from hip impingement. So manage that knee pain, start learning more about fixing your hip impingement and getting the hips to work like they're supposed to. Check out the videos that are already uploaded onto the You Improve PT YouTube channel, and get ready to improve your pain, improve your movement, and improve your life.